And I wonder if it's because, this is the female body protecting the baby. So women's health is a topic that is discussed a lot nowadays, but I think it's really important not just to talk about women's overall health, but women's oral health. And I think it'd be really interesting to understand what changes take place in terms of women's oral health during pregnancy.
So, we've already spoken about the mouth-body connection, and when it comes to women's health, you see a lot of it manifesting itself in the mouth. So if we start with pregnancy or the changes in hormones, we see an increase in gum problems. So because of that change in hormones, it's to be expected that you may be more prone to bleeding gums.
So I've got my own theory about this, and I can't say that it's proven, but you see in pregnancy that because of the changes in hormones that women have, they react to the smallest amount of plaque in their mouth with incredible voracity and inflammation. So where somebody might have a little bit of plaque and they get very little inflammation, pregnant women seem to really come out in force in terms of that level. And I wonder if it's because this is the female body protecting the baby, because effectively that bacteria that's coming into the mouth is bad bacteria that could get into the bloodstream and could affect the baby. And I wonder if it's the human being's way of protecting a baby.
Yeah, that's interesting. It might be. But I think it's important for dentists to kind of reassure pregnant patients that actually not to worry too much, which I know goes against everything we've said about bleeding gums, but actually to be like, do you know what, as long as you're maintaining that oral health and just making sure you're trying to get that plaque under control, not to get overly stressed if those gums are bleeding a lot. Yeah,
I think you do get that hypersensitivity or hyperreaction to plaque, but I do also think it's really important to, if you are suffering like that, to perhaps come more regularly for hygiene treatment, so that you're reducing the amount of plaque and accordingly the amount of inflammation that you would have.